1-855 Dr. Lou, DRLOU. That is the contact number. info@paincarecanada.com. Back with another edition of the Dr. Payne Show here on your weekend. Oh, look, Dr. Gordon's back. We got some professionalism with us today.
Finally, I know.
We
need to change it up. And
You've upped your ante a little.
Bring in the real professionals. Yes,
that's right.
For sure.
What's going on, pal?
Not too much. How are you?
Good, man. What was the week that was? We always start with something that's going on in your clinic and around. What do you say?
I mean, we brought in Dr. Gordon today. We have a lot of people when they suffer from foot pain, plantar fasciitis, which we've heard a lot. We often will end up, if through conservative therapy, like just regular physiotherapy and low-level interventions like that, things aren't working, we'll often recommend them for shockwave therapy. Okay. And, we're lucky enough that Dr. Gordon is also a medical consultant for Shockwave Canada, which is a company that supplies these machines. And, there's a lot of great indications for shockwave therapy. And a lot of people don't know about it. They don't know where they should be going, what type of things it helps for. For whatever reason, people do have the perception with a lot of people come in and say, I've heard that for plantar fasciitis, shockwave is really good. What do you think? And of course, we go through it. But there's a lot of things that shockwave is actually used for, and Dr. Gordon will go through a lot of these indications. He'll give you a bit of the history. And so, we thought it would be really, really good because, on the Dr. Payne Show, we always like to provide, the latest, greatest things out there. And be the nice thing about shockwave therapy for a lot of the MSK injuries, and Dr. Gordon will even talk about some non-MSK things that it's very useful for. But with the MSK injuries, we've always talked about if you can be as conservative as possible and as least invasive as possible, that it tends to be good for everybody. The patients tend to prefer that. So it's another tool that can be used if you're suffering from certain different types of injuries and you don't necessarily want to go different routes. This has some very good efficacy behind it, especially for certain types of injuries and pathologies. And it's a great therapy. So let's turn it over to Dr. Gordon. And I think, Dr. Gordon, if you could just simply start with what is shockwave therapy?
Good to be here. Thanks for having me.
No problem.
So shockwave therapy is a therapy that's been around over 30 years, and it was first invented for kidney stones. And I don't know if you know about that, but when you have kidney stones, you get these shock waves, and they blast the calcium and
blow it apart.
Yeah. We have two places in Ontario that has that, London and St. Mike's here in Toronto, that offers the shock wave, and there's a big lineup for it and waiting list, but it's great because it works very, very well. So as always, things in medicine happen serendipitously. Can you say that twice, Dr. Luke?
I can't say it once.
I'm not even going to try the first time.
So a doctor in Austria found out that when they looked at the kidneys, that there was a lot of blood flow and reaction around the kidneys when they were doing that. And this fella thought, okay, why don't I try this on some rabbit Achilles tendons?
Okay.
So he started treating some tendons and found that they actually got better. And he created tendonitis in rabbits and in dogs and was treating them with shockwave and had great results. So what is shockwave? So it's a high-powered sound wave, and you may hear it referred to as a pressure wave, shock wave, acoustic wave, acoustic energy. There's different names for it, but really the shock wave is the one that's used around the world. And as I said, it's been used for over 20 years with great success.
Okay. And so what is the reason why it works? Like, what are the things from an MSK perspective? Like, why does applying these sound waves or acoustic waves work in getting tissue better?
So the way they work is by creating a stimulus in the tissue. So a lot of things like what we talked about on the previous shows, like rotator cuff, tennis elbow, hamstring, these tendinopathies, which are called tendonitis, is actually a degeneration of the tissue. The tissue's actually dying, and it can't recover, and some people can't recover. So we'll use plantar fasciitis as an example. You can be big, small, tall, short, come from many places, and it affects everyone the same way. No one knows why. Right. So they get this degeneration at the bottom of their foot. They wake up in the morning, they put their foot down and go, oh, my God, it feels like I'm walking on glass. And what happens is they try to do therapies and they fail. And once they fail, they do this shockwave therapy. And it's actually 84% successful in what we call double-blind, randomized controlled studies.
Wow. And so is the mechanism that these shock waves help to promote tissue healing? How does that work?
That's exactly it. And the company originally called them a tissue regenerator because that's exactly what it does. So with the hyaline degeneration, You do these shock waves. It takes 4 minutes for a treatment. You only need 3 treatments, 1 week apart, which are provided at these clinics. And it's amazing. It doesn't take up a lot of your time. You come in, you go out, you can go play tennis or run a radio show, whatever you want.
And it's not painful at all, right?
No, it's not.
There's no pain. I mean, when you hear the name shockwave, it may sound like it might be a little bit painful, but there's no pain associated with it.
But
Well, it's a lot sexier than tendon or tissue regenerator, right?
Yeah,
Shockwave.
Shockwave. As a matter of fact, they found out this is cool. This is sexy how they found it out. It was in the Second World War where the mines were going off underwater, and there were people on shore in the South Pacific, and they were being affected by the shockwave that was generated through the water. And that's how they actually found out how
really
they were
cool.
propagated.
That's incredible. Yeah. I mean, it's interesting. You brought up the point with things like the rotator cuff injuries or the plantar fasciitis, where it's actually a degeneration of the tendons. And I guess for such a long time, even with like an Achilles tendonitis, where tendonitis indicating inflammation. But then I know once they've done a lot of research on a lot of these different areas, there's actually not very much inflammation, and that's why we've moved towards the term of tendinopathy, to just suggest that there's a degenerative process going on. And so it's funny because a lot of people, because of the history of things being called a tendinitis, they're often just prescribed anti-inflammatories thinking that will help. But
that's actually worse because you want the inflammation because that's where the healing cells come from. And we'll talk about that in the next segment in a second. How that
Short
happens.
break. Dr. Gordon's here for the duration. You need to get a hold of Dr. Lou anytime, 1-855-55-Dr. Lou, DRLOU, and email rather is info@paincarecanada.com. It's the Dr. Payne Show, Global News Radio, 640 Toronto. 1-855-55-Dr. Lou, DRLOU, info@paincarecanada.com. Talking shockwave therapy. Dr. Gordon's here to elaborate and give us more insight.
Medical consultant again for Shockwave Canada, which is a very reputable supplier of these machines. And I think later on we're going to get into, I know in speaking with Dr. Gordon personally, there's a lot of places out there that have fake machines, and that's obviously a problem, and we want to make sure that our audience, if you are going to be going for this type of therapy, that you're getting the actual therapy. You're not getting some type of a sham just because someone's trying to make a quick buck. But before we went to break, we discussed a little bit about how historically there was this thought that it was an Achilles tendonitis or plantar fasciitis, and that there's this inflammation. And Dr. Gordon mentioned the degenerative process that's actually happening. And because of this historic perception about the inflammation, oftentimes these types of injuries are actually treated with anti-inflammatories. Like just initially, you go see someone quickly, and it's like, yeah, you've got an Achilles tendonitis, there's inflammation there, take an anti-inflammatory. And Dr. Gordon, before we went to break, you actually mentioned that may actually be worse overall for the prognostic factors for these patients to get better, because you actually don't want to eliminate the inflammation. So take us through that.
Sure. So as we mentioned, it's a degeneration. So what you would like to do is create generation of tissue and cells. So what happens is shockwave creates nitrous oxide, which is a banned substance, performing substance. It creates endothelial growth factor, which helps cells and blood vessels grow into the injured tissue, and bone morphogenic protein, because it's also good for bones that don't heal. So if someone has a broken bone, you can actually heal them faster with the treatment. Or if they're a delayed healer or delayed in healing their bone, you can treat them with that as well, which has been shown in numerous studies in Journal of Bone and Joint Surgery, which is our Bible of scientific evidence, that it helps that way. So if you use an anti-inflammatory, it blocks that cascade. That's how aspirin works, right? Why do we take aspirin? Because it blocks that inflammation that creates the pain.
Right.
So with healing, we do want inflammation, and that's part of the healing process. So the shockwave creates that ability to heal. And it's really interesting. We talked about this outside the room earlier, that actually with horse racing, they actually ban shockwave on the treatment of horses because it gives them such a huge advantage in healing and feeling better.
Wow.
So I believe it's 3 days before you cannot use shockwave on horses.
Wow. Well, that regenerative process, a lot of the things, I think if anyone's ever been to therapy, one of the things that's most often used is just a simple TENS machine, an electrical therapy. And we would call that just what's called a pain modality. There's no real healing effect towards it. And it's funny because there's, people love the feeling of a TENS machine, like when they put it on and it gives them that massage. But really it just works on a pain level where you're just trying to to block a person's perception of that pain with that machine. But then there's other things that we call healing modalities, and these are the things that are actually beneficial towards the healing process, which this is the great thing about shockwave therapy, is that it actually focuses on the healing process. You're not just focused here on eliminating pain for 5 minutes, 10 minutes, half an hour, something like that. What you're actually focused on is, like you said, Dr. Gordon, regeneration of tissue. And in regenerating that tissue, you're able to get better. And actually, it was interesting, actually, when you mentioned the fractures and how it helps to heal fractures. I know that a lot of people, I think it might be a common perception that if you have a fracture, you put a cast on it and it should just heal. That doesn't always happen. People heal differently. And even if you have a cast on it, you may not heal as quick as someone else or someone who's healthy, or you may have certain things, other comorbidities, things like that would slow that down. And so it's very important, if you have one of those other things going on and you have a fracture, maybe doing something more like shockwave therapy is going to help to regenerate that tissue quicker.
Well, the classic one there is a female athlete and a long-distance runner, so they tend not to heal as well. It really works well for that. But it's also, with respect to pain, shockwave also works on substance P. Substance P has something that has to do with pain. Mm-hmm. So not only does it regenerate tissue, it also has an anesthetic effect and helps with pain as well.
So it's got both properties. It's
both. Double whammy.
Both a pain modality and a healing modality, which again tends to be, to some extent in my experience, rare with other different forms of therapies. What are some of again, we started the show off by saying the plantar fasciitis is a big reason that people seek shockwave therapy. What are some other more common injuries that it has really good efficacy for?
Well, I just want to make a couple comments on that. So plantar fasciitis affects 13 million people in North America at one time. That's what we talk about. It's so prevalent. Mm-hmm. And then we'll just go from the top to the bottom. As you know, Dr. Lou, you're good with the neck and the back. It works really, really well on neck pain and back pain, and you get immediate relief with that, especially trigger points, where it can give you immediate relief on that. And then we'll go to the shoulder, calcific rotator cuff tendinopathy, 91% success rate.
I've seen that really good research with the calcific tendinitis.
And tennis elbow, which is the bane of our existence. We have over 40 operations to try to treat it. And why? Because they all suck, right? So if you had one, you're going to do one. But
that's a good point.
Yeah, 4. I'm allowed to say suck. Right?
Big time.
Okay. Yeah. And so it doesn't work quite appropriately on tennis elbow. But so shockwave, it does work, but not as well as the other ones. Hamstring's incredible. So they had a study in the English Premier League on professional soccer players. They did a sham where the ones that were injured with a hamstring did not get it, and the other ones did get the shockwave. And the soccer players in the EPL who got them were 8.5 times more likely to go back sooner and better. Great study.
That's what we call statistically significant for sure.
Yeah, hamstring. Even though it is the EPL, there are some other real leagues elsewhere.
You gotta love Dr. Gordon. He always throws in low blows everywhere.
Is Italy in the World Cup this year? I can't remember.
Wow!
Low blow. So sad.
The number is 1-855-55 Dr. Lou, DRLOU, or
I'm
info.
more available in June and July this year than usual.
Than you've ever been, right?
Yeah. The gelaterias are really going to be hurting this year.
Email, by the way, info@paincarecanada.com. Again, 1-855-55 Dr. Lou. More of the Dr. Payne Show on the way. Global News Radio, 640 Toronto. 1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com. We're talking shockwave therapy. Dr. Gordon's back on the show. You guys mentioned, Luigi, you mentioned that you got to watch out for a lot of snake oil, a lot of fake machines out there, guys trying to make a buck.
Yeah.
And Dr. Gordon, you mentioned off the top, there's one in London, one here at St. Mike's, you said?
Yeah.
So I take it this is an expensive machine?
No, those are the bigger ones, the heavy-duty ones you need for the kidney stones and blasting. But the other ones are incredibly affordable.
Cool.
They're affordable for anyone that's a healthcare professional, massage therapists, chiropractors, physiotherapists, sports physicians, orthopedic surgeons. And that's one of the beautiful things about Canada. They introduced this, Shockwave Canada introduced it to Canada to make it affordable to the healthcare professionals so that patients can afford to have it. And that's why Dr. Lou, and he knows it, provides it, and it's a great service. But yes, there are fake machines out there, unfortunately, from many, many countries. But the ones from Switzerland, Storz is definitely FDA and Health Canada approved, and there's one other one as well. And they're the ones that you really want to get.
Yeah. I mean, and we've talked about there's no shortage of clinics out there trying to make a quick buck, and that's why finding a reputable clinic is very important for anything. I mean, we've discussed this also, that we try to stock our clinics with with everything when it comes to the therapy interventions, because we're not just trying to sell Shockwave to everybody, or we're not just trying to give PRP injections to everyone, or we're not just trying to get everybody on massage therapy or whatnot. We're really trying to deal with people's issues and make the best treatment advice based on the literature. And it's really good when you can find a place that has all of these things available to patients, because, I mean, I've said before, if all you have is a hammer, then everything becomes a nail. And it's nice that when you're going to places, clinics that have multiple treatment interventions available, you can feel somewhat confident that they're not just trying to sell you one thing. It's not and I've seen certain clinics where it's just one modality or one therapy, and that apparently will cure everything. Everything under the sun is cured by this one thing. But we really try to focus on. Thanks for having your phone going off.
It's not mine. It's Dr. Gordon's.
I don't have a phone.
Oh, damn it!
I work for the government.
Wow.
So it's very important. Before we went to break, Dr. Gordon was taking us through the different areas of the body, and we were ending off with the English Premier League and the study on the soccer players with the hamstring injuries, and they had insertional tendinopathies, and it really helped with that. And I mean, a big thing that, just because it was interesting, and now the research doesn't necessarily correlate for sure, but a lot of low back injuries that end up happening, people end up having very tight hamstrings or old hamstring injuries that lead to that. So that's where seeing someone who works on a functional perspective and not just looking at that one area that you're complaining about. But even when I see a patient with low back pain, I assess them from a functional perspective. Are there hamstring issues going on? Is there a kinetic chain issue going on somewhere else? And these types of therapies are great, because if you can find, maybe it was an old hamstring injury or something like that, where you can use, again, like Dr. Gordon said, a modality that both has an effect on pain, right, but also on healing, which is, again, very, very rare to find that. So, Dr. Gordon, if you could still take us through. So we ended off on the hamstrings. What other things is it very good for?
So then the bursa, the greater trochanteric bursa.
Okay.
So, when you're lying on your side and you feel that pain on the side of your hip, it's very successful for that. Then jumper's knee. So basketball players, soccer players, when you jump, you get that pain common in the front. So that's about 76%. Wow. And I'm giving you real numbers. I'm not going to sit here and tell you it's 99% and it's the greatest thing. But 76% is very, very good. It's a very tough problem in the literature. It's comparable to surgery. And remember, a chance to cut's a chance to cure. But if we can heal people without surgery, that's always the greatest thing, right? It's comparable. Then from there, we go to the Achilles tendon. Again, if you do eccentric loading exercises, which I'm sure your clinics teach your patients. And again, I have to congratulate you. Even though you invited me, you're the host, I still have to congratulate you that you do you do the holistic treatment. I mean, you're doing this eccentric loading. You're offering many modalities and ways to treat people and give them the best chance to get better. So with the Achilles, you do the eccentric loading and the Shockwave. Very successful, again, 76%. And then the sine qua non is the plantar fascia, which is 84% successful. Actually, that's true, but the shoulder actually is 91% successful. So
those are crazy numbers.
Great numbers. Yeah. And it does take a while because you're regenerating tissue. It doesn't happen tomorrow. That's why I always have difficulty doing my clinics down at Bay and King as opposed to in the West, because they want to be better yesterday, right?
Yeah.
And
I mean, this, we should also mention, and I think the regular listeners will know, but we introduced Dr. Gordon today as the medical consultant for Shockwave Canada, but he's also an orthopedic surgeon, and you just heard what he said, which is if you can avoid surgery, why not? And it's great to see that Dr. Gordon is looking out for whatever. Like Dr. Gordon and I have a very similar philosophy on if we can be least invasive and move towards those more invasive options. I think everyone prefers that, right? Because people don't necessarily want to go under surgery immediately if they can try other things. And that's why we're constantly on the show presenting all these new things. And I mean, we had Dr. Gordon on a number of weeks ago where we talked about the PRP injections, and he took us through a lot of great research for knee osteoarthritis and wanting to help with the inflammation and pain associated with that. And I think Dr. Gordon also gives us great real numbers. He's not sitting here telling us, like he said, that it's 100% effective. He's giving you the real numbers that for some things like the jumper's knee, it was 76%. But if you've had that issue and it's not been getting better, I mean, those are pretty good odds. Those are good odds. And I know you, Dr. Gordon, there are other things that shockwave therapy is used for, but the efficacy isn't as strong, and you won't even recommend that because you're not seeing that research. And you gave me an example outside if you want to take us through it.
Sure, we can use it for cellulite. It's used for that, but it's not fantastic. The other one, the newer one that we're doing in Canada now is erectile dysfunction.
Right.
That is sort of musculoskeletal, but
to some extent.
That's a 70% success rate, and for people who suffer from that, that is a fantastic relief if they're able to do that. I think it's fantastic, and we have other things as well that are coming along, and we're doing research every year. It's amazing what's being developed with the Shockwave.
We'll take a short break, guys. 1-855-55-Dr. Lou, DRLOU, and info@paincarecanada.com. Dr. Pain Show, Global News Radio, 640 Toronto. The number is 1-855-55-Dr. Lou, DRLOU, info@paincarecanada.com. Anytime. Shockwave therapy, that's the focus of the show today. Interesting stuff and fantastic odds as far as treatment is concerned. I mean, 76% it was almost the low end of the number. And if someone said, I'll give you a Lotto Max ticket, you got a 76% chance of winning the jackpot.
We'd be buying
You're buying that
tickets,
ticket, right?
Yeah, more than one, that's for sure.
No kidding.
Dr. Gordon, we ended off with some indications, different types of reasons why you would want to get shockwave therapy. And during the break, you were also talking about that to some extent it's a performance-enhancing modality as well. And you gave us some cool examples if you want to just reiterate those for our listeners.
So one of the easier ones we mentioned already, was in horses and horse racing, that it increases their ability to race so well. That's actually banned for 2 to 3 days beforehand. We've had machines in the Olympic Village, so the trainers and the physiotherapists and their exercise physiologists, their team would come and use it, because if you're going for a long run, let's say you're doing the 5-10K, it's unbelievable. You work on the muscles, you work on the hamstrings, the gastrocs or the calf muscles, and really, really helps them. We have a lot of professional athletes that use them. So in the NFL especially, they get really beaten up, bruised. They're having it. They have their own. So a lot of players have their own devices. And the ATP Tour, which I used to consult for, the Association of Tennis Professionals, a lot of the world top athletes, they would get the treatment before and after to help them, because not only is it helping them perform, I can't prove this, but I think it's also preventing injury as well, which is really important.
Right. And again, you don't have the research for that, but that's based on what you've seen in practice in doing this. And how long have you been working with Shockwave, Dr. Gordon?
So I've been doing this for 20 years.
Wow.
Someone knocked on my door at one of my sports clinics and said, I got this great invention. You got to try it. And we always go, oh, yeah, whatever, sure. And I did treat them. I wanted to see if it worked. I treated 10 of my friends.
Right.
7 of them loved it. 3 of them ran out of the room. But you can trust your friends, and we've done that in medicine over the ages. Well, if you're going to do something, do it on yourself and your friends.
Right.
Yeah, right.
Yeah, it's a good way to start.
And one of them said...
Or are you going to use John Scholes from now on, by the way?
Whatever. I'm game.
And one of them actually was in the Olympics and set a record after we treated him. It was pretty incredible.
So obviously it's not banned. It's therapy.
Oh, absolutely.
No. This is very widely used. Again, we get lots of calls where people have been recommended by their family doctors or someone that they should have shockwave therapy. There's lots of good literature to support it, and again, it's just very, very convenient that Dr. Gordon, being a medical consultant for Shockwave Canada, we have this kind of resource at our disposal for our listeners. So that they can get educated on these things, because a lot of our listeners are just looking for other ways to get better. It's funny because I'll get emails of people who are sending me a list of things that they've done, and it's always the more traditional things. Like they've done the standard physiotherapy. They've gotten it's funny when we talked about the cortisone injections for the knees. Like everybody that's had knee issues calls and says, I've had cortisone
and that
injections.
drives me insane, and I'm happy to say this on the radio. It drives me nuts because the literature is clear on that it does not work.
And this is coming from an orthopedic surgeon who specializes in knees. Like that's what I try explaining to people when I tell them that it's essentially useless. Like they're getting it. And you mentioned
some of the things when you get cortisone, I'll just give you some of the bad things. Okay?
Yeah, okay.
And not to scare people, but you can get an injection for plantar fasciitis. You can tear your plantar fascia. And I had a center from the NBA who had an injection, had it, and he tore his and never played again. Tore his fascia. Okay, we just had a patient die from a cortisone injection.
What?
Now that's very rare.
Yeah,
very rare. Got an injection in the shoulder. Got infected because you get infections from needles, and the poor chap died. Okay, so it's not without complications. I'm not trying to
of
scare
course,
anybody,
Mm-hmm.
but again, if we talk about evidence, and I appreciate you're always asking scientific evidence, and I'm very passionate about that. So I like to teach, educate, and I'm trying to be fair and give honest answers.
No,
and
absolutely.
I want people to be informed. So that's why the Shockwave that's out there, we talked about with a success rate in double-blind randomized controlled studies, the PRP, double-blind randomized controlled studies. And don't be afraid if you're a patient. Ask
Yes.
what you're using. Ask for information. Ask me, what's the evidence behind that?
Yeah.
I mean, am I allowed to pick on things?
Absolutely.
Oh, yeah.
Go for it.
Okay.
Yeah.
So laser. Give me one study on laser therapy. Okay, now there is not one that shows in a double-blind randomized controlled study for tendinopathy that it works.
Right.
Okay? Some things it does work for rheumatoid, a couple things like that. But again, don't be afraid to ask. And if it's a machine, say, what machine do you have?
Absolutely, yeah.
You know, which machine is this?
Yeah, it's funny that you bring that up because so often I meet people that are just afraid to ask their healthcare professionals questions about they'll call me because they hear the show and so they feel like they can talk to me. And it's crazy. I've had people that I actually spoke to somebody today who was going to go for a certain type of spine surgery. I can't remember what he said now, but he wanted to know the risks and benefits and he wanted to know it from me. And I said, well, did you speak to the surgeon who's going to do this operation? He said, yeah, but I didn't really ask him that. And it's like, well, no, you should.
Faith.
You should. And, you brought up the risk of like the injections and that you had someone die. Now, obviously, those things are very, very rare. And every single intervention has a risk and benefit. It's just nice that if you're going to take the risk that, the efficacy for whatever you're taking the risk would be really good, right? Like at least if you're doing something, people who need bypass surgery, and because otherwise they're a ticking time bomb, they're taking a risk. It's heart surgery,
Sure.
but they understand that risk. And after that surgery, you're likely to be a lot better. Granted, you have to still take care of yourself and make sure you don't go back into your bad habits. But, it's really important when you're going to do these things that there's good evidence to support the indication of whatever's being done. And again, we've gone through what evidence-based medicine is multiple times, where it's the best available medical literature. It's the clinician's experience as well. And I mean, we have someone here who's a seasoned professional in Dr. Gordon, and this isn't someone who's you haven't only operated on 2 knees in your life, right?
2.5.
maybe.
2.5.
Yeah.
2.5.
And so
it was half a knee.
Yeah, exactly. And you're telling us that something as prevalent as cortisone that everybody you talk to is getting it. Whereas, maybe if they did something like shockwave therapy or PRP, again, depending on what the issue is, there'd be a lot more people getting better. Yeah.
Communication's the most important thing in medicine. We have to communicate to our patients. You do the same thing. They have to understand, and when they leave your office or an office of a physician or healthcare professional, be confident. Ask yourself questions. Ask the practitioner questions. Never leave without any questions unanswered.
Contact is also a question as well. That's simple, 1-855-55-Dr. Lou, DRLOU. Email info@paincarecanada.com. Dr. Pain Show, Global News Radio, 640 Toronto. 1-855-55-Dr. Lou, DRLOU. Info@paincarecanada.com. Dr. Gordon is here. We're talking about shockwave therapy. We haven't covered, so I will ask side effects. What are they?
Well, the beautiful thing about shockwave, there are no side effects. You can have a little bit of bruising, a little bit of discomfort for a minute or two, but that's really it. There are no...
There's no major side effects.
And the
very
contraindications, so people you can't do it in are pregnant women. And
Right.
That's not medical. That's legal.
Yeah.
Um,
That's usually a contraindication for a lot of things.
and people who have cancer have had systemic type cancer because we don't know what it does to the cells. So those are really the only 2 contraindications.
And the cancer contraindication is for a lot of different modalities, especially something where it's an active process, and this is causing regeneration.
Mm-hmm.
You definitely don't want to be doing that to cancer. That's only going to help the cancer.
And interesting, people who are in blood thinners, they actually do better because they bruise more and they have more blood flow to the area. Well, the other contraindication is if you're a Montreal Canadiens fan. I know that. Sorry.
I thought he was being serious. I didn't see it coming.
Tip your waiter, folks.
No, I mean, that's incredible. And again, we were talking about where if you're going to do something, you want to do things where if you are going to take a risk that there's good. So we've gone through that. This has really good research evidence to support it, and also has low risk, almost no side effects, with the exception of some simple things that Dr. Gordon has taken us through. So, I mean, if you're suffering from some of these musculoskeletal injuries that that Dr. Gordon mentioned, and you've tried other things, you're not getting better, why not do this? Now, let's because we kind of started with the plantar fasciitis, so let's just go back to it. How many treatments of shockwave therapy does it take to get something like that better? Now, obviously, it very much depends on how old that injury is and the prognostic factors of the patient, but in general.
So the study was really cool that was done. People have had to have it for 16 months and failed everything to be included in the study. So that means they failed everything else, non-operative treatment. They were included in the study, and then of those, 84% got better. So that's incredible. So normally 90% of the people get better, 10 don't. So of those 10 that didn't get better from everything, 84% of them
and
got
how many
better.
treatments?
So it's 3 treatments, 1 week apart. And again, we go back to this. If your practitioner is saying 5, 6, 10 treatments, run out the door.
Right.
Okay.
So that's good. You guys have heard it straight from the source here.
So 3 times, that's 3 or 4. It could be 4, but 3 is general 1 week apart. And that's the protocol.
And that was for plantar fasciitis. What about for other things
it
like
is
the
for
tendinitis?
the other ones as well. So
3
hamstrings, 3 to 4. Achilles sometimes 4. Rotator cuffs 3. That's what it is. It's 3 times.
And
what's the treatment like when you're there? Is it like, take a shot of bourbon and bite down a leather strap?
No.
Or it's not,
Only
it's,
if
it's
you
not
come in, I'll offer you the bourbon.
I'll bring the bourbon.
So it's not painful. It can be mildly uncomfortable sometimes.
Wow.
Again, but that's with this technology now, and it's advanced a lot. So, we're at the iPhone 10 stage now, where the old machine was too. My first machine actually was 400 pounds and cost $450,000.
Wow.
And now the machine is very affordable. It's in the low teens, and the treatment can cost, I don't know, 60 to 100 to 200 bucks,
Wow,
something
no
like
kidding.
that. So it's very affordable, covered by a lot of insurance. I think your clinic's covered through insurance. So it's very, very affordable. And that's the nice thing about Storz, the company, the manufacturer. Again, they wanted to make it affordable for all Canadians. Whereas before, $450,000 is not very affordable.
No.
Yeah, once someone has to pay back that machine, that gets quite expensive. But I think it's very interesting that you mentioned the 3 to 4 treatments. I've actually had people that have said, I was told to go for like 20 treatments of shockwave therapy. And that's really, really important what you said. There's certain things, and I talk about this, like red flags that if someone tells you, again, there's good efficacy to support it, but it should be based on the research. And if the research is suggesting that 3 to 4 treatments for most of the things that we've talked about, and someone is recommending 10, 6, whatever it may be, maybe 6, depending on whatever, prognostic factors that the patient, but, I've heard people 10, 20 treatments, that's a red flag. I think that's where you got to be worried.
The only corollary to that is that if you're doing myofascial or muscle pain, trigger points, lower back, you can come for many treatments. So we have to remember the tendinopathies, it's 3 to 4 times. But if you're doing myofascial, or you're doing it before a 10K race or a marathon or a lot of sports, you can come in and get treated as often as you want to get for a regenerative point to help performance. So that's different. That's not a tendinopathy.
Yeah, no, I was specifically talking about that. I've heard people that for shoulder tendinopathies or the plantar fasciitis that they've been told
3 times.
Yeah, and that's it. You guys have heard it, that 3 times is all you're going to take. And again, these treatments are very inexpensive. They're not. And again, as Dr. Gordon said, depending on the professional that's doing it, it's covered through most insurance plans as well. So, I mean, why not give it a shot? And a lot of, Dr. Gordon mentioned that these machines are quite affordable, but a lot of clinics out there don't invest in these types of things because they just want to keep it simple. They don't want to get into these things. And, I mean, it's worth the money to have these tools.
That's why we're here today. We want to educate not only the patients but also healthcare professionals.
Absolutely.
If they're thinking of sitting on the fence, and it's amazing. I get some of the stats from some of the companies, and they said that of the 2,000 that they've sold and clinics in Canada, not one has ever been resold. You can't buy a used one, and the only one ever got changed hands was in a divorce settlement that they fought over the shock. I swear, they fought over the shockwave machine, husband-wife clinic.
Someone got the house, the other person got the
I'll take the
shockwave
machine.
machine.
Thanks. It's got a leaky roof. You don't want it.
So,
no kidding.
Oh, wow. That's incredible.
So
but
education's important. It's
absolutely,
out there,
yeah.
and if you're sitting on the fence, it's a fantastic
And if you
modality.
guys, if you're thinking about it, give me a call. I can get you in contact with Dr. Gordon and Shockwave Canada. And this is specifically for the healthcare professionals. If you want to find out more, I know Dr. Gordon's great. He's always available to talk and to answer questions. And again, he's never been someone that I know to force anything upon anybody. It's really the advantage comes to that you have a great tool at your disposal to help your patients out that are suffering from these degenerative processes like the tendinopathies in the shoulder, the musculoskeletal issues like the myofascial pain. And it's nice to have another tool because not everybody responds to the same things. And if you can have these multiple tools in your tool belt to try to help patients, that's where the best success comes out. And I mean, the research is clear on that too, where the multidisciplinary approach where you have multiple professionals, multiple treatment interventions is really the progression of MSK and how that's and how things will be dealt with in the future. It works the best for sure.
1-855-55-Dr. DRLOU, and email is info@paincarecanada.com. Still got a few more minutes. Hang on, we'll be back. More Dr. Payne Show, Global News Radio 640 Toronto. 1-855-55-Dr. DRLOU, info@paincarecanada.com. That is the contact to get a hold of Dr. Lou or Dr. Gordon for that matter. We're going to finish up, continue talking about this morning shockwave therapy. It's kind of cool stuff. Right?
Absolutely. And I mean, on the break, we were just talking about some of the other indications for shockwave therapy. We've talked about a lot of the tendinopathies, the myofascial pain. So if you're suffering from a shoulder injury, like a rotator cuff injury, tennis elbow, golfer's elbow, patellofemoral pain or jumper's knee, runner's knee, those types of things, the plantar fasciitis, obviously give us a call. But there's also some, what Dr. Gordon called wacky things that it's used for. They're not so wacky, and I think it just goes to highlight how great of a tool this is, because when something works on multiple things, I mean, I think that's an indication that it's
versatility is good.
Versatility is good, exactly. So take us through those things, Dr. Gordon.
Well, we're in soccer season, so a lot of the kids suffer for something called Osgood-Schlatter, that little bump on the front of the shin below the knee. Works really, really well for that.
And that tends to be really painful for the kids that are undergoing that process. So I know any parents that have kids that have Osgood-Schlatters, they know that they have it. But, and the pain is what they're trying to manage, essentially.
Parents always get mad with me because I tell the youngin that they don't have to do their chores because they don't have to get down on their knees and pick up their clothes, because that hurts. That really hurts. Doctor. Yeah. So you young guys know.
Yeah, you got to go see Dr. Gordon if you want out of the chores.
And it helps with the healing of ACL reconstructions or anterior cruciate ligament. They weave the tendon through the bone, and we've shown a study.
Is post-surgery?
Post-surgery helps the healing post-surgically.
Wow.
Helps wounds. There's a big study going on in the States about wounds that don't heal, so it helps heal wounds. And
what types of wounds, like things?
So for chronic ulcer wounds, diabetic ulcers, that's right. Because remember, it regenerates and creates
even
vascularity.
Maybe potentially bed sores, things like that, or not necessarily.
I can't comment. I've seen some, but that's anecdotal. So I only like to give you the research, as you know. And I think those are some of the cool things. And fractures, we talked about that as well. That if you've got a fracture or a broken bone, you actually can heal faster, and it increases what's called the bone morphogenic protein, which is what you need to heal bones.
Yeah, and it's interesting that you bring that up, because when I was a student, I did a research study on fractures that weren't healing in the different modalities, and shockwave therapy and microcurrent are the two things that I came across that had good efficacy to help. And again, it's crazy, because most people think you get a cast on, your fracture is going to heal in 6 weeks, 8 weeks, whatever they're telling you, and that's it. But it's crazy. It's equally crazy how often that doesn't happen, that the fracture hasn't healed. And when that happens, and if you're somebody that's happened to, and you just went for an X-ray and they told you it's still not healed, you may want to consider something like shockwave therapy to help that fracture heal, to speed up that regenerative process, so that you can get back to doing what you have to do. Because the longer that you're immobilized or that you can't use it, the bigger the other complications that will or could arise from the disuse and just the chronicity that can develop. So I think that's really, really important, that the fractures, that the regenerative. And again, I just think it sounds, I mean, it's one of those things that almost sounds too good to be true.
Yeah, it's like the WD-40 of therapies.
Low rate.
Windex is good too.
Yeah, so no very, very little side effects. You heard Dr. Gordon himself say that something like a plantar fasciitis or a rotator cuff tendinopathy, you should be getting 3, maybe 4 treatments. So that is, one of the things, it's when you speak with people, when it comes to especially high-end professionals or anybody, I think it's anybody that's busy. when you have to
time.
do therapy, it's time. You've even said this to me before with your neck, where you're like, I just don't have the time. And a lot of times the more traditional physiotherapy, the chiropractic, in the beginning might be a little bit more time consuming, where it might be 2 or 3 times a week for a number of weeks. This is great for someone who doesn't have a lot of time. 3 to 4 times, once a week. I mean, who
And it's
can't?
4-minute treatment.
And 4-minute
I
treatment.
can't beat that.
Yeah, how can you beat that? And it's worth giving it a shot. Very inexpensive, covered by most extended healthcare plans. So if you're suffering from one of those things, give us a call. Dr. Gordon, is there anything else that our listeners should know about shockwave therapy that we haven't gone through? I mean, you've done a great job. I think you did a good job.
You guys did.
But yeah, I think it's very important, and again, with since we have Dr. Gordon on the show, again highlighting the Knee Clinic initiative that people who may be surgical candidates and don't know about it, you can give me a call if we go through a set of questions. If you are a candidate, we'll be able to send you directly to one of the specialists that we work with, one of them being Dr. Gordon. And that way, again, you can get in sooner. Also on the knee pain front, if you're suffering from osteoarthritis and you've tried a lot of different things and you're not getting better, you're trying to delay that surgery of eventually getting a knee replacement, and you just need something to help control the inflammation and the pain associated with those things. We've gone through the PRP injections, which Dr. Gordon, again, did a great job on taking us through the research around PRP injections on the show that we did about it. He's incredible with you always have the stats, though. You always have how many people does this affect in North
people
America.
want to hear that stuff,
yeah, exactly.
right?
But it's incredible when you hear how big these things are, and I think it's a very easy way to understand it when you can hear just the economic scale of what these things. What was the stat on how many people will need knee replacements?
Putting me on the spot.
You don't remember? I remember you quoted, but it was something it was
a crazy number.
Yeah, it was insane. But so all of these things, and again, any type of issue. And again, we were talking about shockwave today, but it doesn't end there. We're here to simply assess people's issues and get them the right treatment. And again, the advantage being that we have all these tools at our disposal, which is why we constantly are talking about the different tools and spending shows on specific topics or specific interventions, just so we can give the full extent. Because obviously this doesn't, I can talk about it for 5 minutes on one show, or we can give all of the information. And there's even so much more information. And if anyone's interested, you can go to shockwavecanadainc.ca. That's where Dr. Gordon is a medical consultant, and they have a great website where they can also take you through some of the research, the things that it's used for, help you find a reputable provider of this therapy and try to get better. And so you can always call me, of course.
Well, you're one of those.
I am, yeah. But I'm happy to, if someone's, wants to, I'm not here to take every single patient. I'm happy to
spread it around.
Yeah, spread it around. If people, there's a lot of people's clinics are already doing these things. And as long as you're happy and there's no red flags going on, then I'm okay with it. But of course we are a provider of this as well.
Good for another week, fellas. We'll take it from there. The contact, 1-855-55-Dr. Lou, DRLOU, and emails info@paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio, 640 Toronto.